Welcome friends. Today we will be having the topic additional to our injury topic, but it is very much concerned with our topic that we take the informed consent from our patients. We go through different channels, and we are supposed to be in the constant in reminded that our patients are the supreme. We don't have the luxury that of being God nowadays. Doctors are not considered to be that. Now we are, as per the Consumer Protection Act, now we are coming under the ambit of Consumer Protection Act 1986. So we are now the service provider, and the service provider should have certain responsibilities to their patient, and we should be very much careful in dealing with them, especially in dealing anything which is related to their body, because as per the various laws and the various judgment, that person is the supreme commander of his body. Nobody can do anything or anything on the person's body, because he is the owner of the body and he can only decide what is to happen and when to happen and where to happen. Because we have, as per the various guidelines, we have come to the conclusions that we have developed various modalities, that who is a person, who is not a person, what are the rights of the person, what the person's human rights are there, a human being, who is a human being, and who we are dealing with. So in the larger context, everything depends upon the human rights. If a human being is there, then he is possessing some rights which are being inherent, and that right should not be violated. So we as a doctor should know that we are now the service providers, and we deal with the patient who is rendering our service. That means who is using our service. So we should be very much careful that while giving the service we should be very much vigilant in skill and care, because that is a part of negligence also. But we should be very much clear on, or very much updated on skills, and our facility should be very much our supporting staff should be very much trained and kind enough to take care of the patient. So in any deficiency, we will be landing in trouble, and in that part, the same part, we should be properly analyzing the patient, properly informing the patient about the procedure, about the stay of the hospital, and then the person should be fully informed, and with conscious mind he can give the consent for a certain procedure, and we should be documenting it in very impartial manner, and should be doing in the presence of a witness. So all the things is happening, but we need to be aware. Most of the time we don't have very luxury of having so explanation, and due to especially the government setups are being so burdened that we are being hurried to many things. But being overloaded doesn't mean that we can overlook the things. We had to be within the laws of the land. Means we have to be within the ambit of all the IPCs and the articles and the CRPCs, so that patient should be cared, and we should also be get protected from being negligent. So it is a balance. So we have to first of all acknowledge ourselves, first of all acknowledge the patient, first of all acknowledge the requirement of the situation and the requirement of the hospital area, disease and all that. Everything should be accounted for and we should be aware that what we should do and what we should not do, and what the patient should be given and what the patient should be receive, and what patient should give permission to do us or move us forward with the treatment. We have come across of a lot of things, lot of cases in our practice that most of the time our people don't explain, or not even to, sometimes they are not well aware with the locality in which they are practicing, sometimes the knowledge of the patient. So we are not able to explain it, we are not able to understand them, or they are not able to understand us. So we have to learn these things, skills, how to make the patient understand, how to explain ourselves to the patient, and so that a proper understanding can develop and patient can give the consent. Because in the court, sometimes if we do or take all the care, but the patient has not understood the process of the operation or the procedure, and he may claim in the court that he was not explained and he was hurriedly being signed and on the consent form and all that. Very means you can be having very varied phenomena from afterwards. So we have to be very much careful in documenting the things. If we have documented the things properly, then in coming days, if the case comes up in court, then we are being saved by these our today's work in the future. So we today's mild care or little carefulness can save us a lot of time and trouble in future. So we should be concentrating on this topic, like what is the autonomy of the person, what is the consent, and what is the informed consent, what are the different variables of the informed consent, how the consent varies, and how the people think about us, and how we should think about the people. So it is a very simple our behavior to the patient, and we should inculcate our habits in day-to-day practice. So let's come to the topic, and first of all, introduction to that. The concept of self-autonomy revolves around the personhood of a person. Means person is a human being who is having self-reliance or self-intent, and he is able to take proper decision with rational mind. So personhood of a person, and this value has different meaning in different cultures. So we will not be talking about cultures here. We will be having a generalized world view, and then the view in the India. World view is that the fundamental principles of autonomy were first expressed in Nuremberg Code in 1947. This code was founded by World Health Organization. So Nuremberg Code is there, that it is autonomy was the first expressed. Means the person's autonomy was recognized, that if anything has to be done on somebody's body, then that person has to decide. He is the sole responsible for his body, and he is the sole owner of his body, and we cannot interfere without his consent. That can lead to assault. The principle of self-autonomy of a person is the availability to think, decide, and act on one's own deliberation and without coercion. Means nobody can force or coerce a person, even if the end person involved decide to let someone else guide to him. Means we can guide, or somebody else guide him or her to take the decision, but cannot coerce it. There should not be any pressure on which the person should give up his self autonomy, because that is the process where we can see in another way, that if we are not doctor, we are a patient, then scenario changes. Then we should think that can we give that decision, have we understood it? So everything comes just 360-degree. Yeah, as a doctor, we think that we should get this done because the patient is this and patient is that and he is going to die and all that. But when we become patient, we have our own apprehensions of fear and all that, and not understanding the procedure, not having the proper money or even the able to carry out the proper resources to carry out the things. So we just need proper guidance to that. Certain fears are there, certain morbidity fears are there, certain mortality fears are there. So anything can happen, and so we should be very much understanding in this, and we should be very much a good listener and motivator, and even try to understand the patient and their respect their decision. We have to respect their decision because we should not be rude to them, and we should be very polite to them, and they should be explained and given time to understand. Article 21 of Indian Constitution provides right to life and personal liberty. Right to life and personal liberty means he has right to live and personal liberty. It means in this personal liberty everything comes, that whether he can go anywhere, whether he can do anything, do any choice, anything, any practice anything. So in that person, that's liberty that also comes, that what should be done on his body or what should not be done in his body, and he is the sole proprietor of that, and he will decide, or he or she will decide what can be done and what cannot be done. There are different scenarios which we will come, that person is not able to understand, person is unconscious, person is a minor or mentally disabled. Then that are the different scenarios we will be discussing in, and we should not be worried about that. We are having remedies for that. And Article 27 simply gives the liberty, personal liberty and right to life. In widest amplitude covers a wide variety of rights, including the right to life in human dignity. It means dignity of the person should be maintained. We should not, our behavior should not be in any way demeaning to the patient, and human dignity should be respected at most. And along with that, all the human dignity, we should extend our services to that. Our hospital should be clean, our hospital should be should be hygienic, our staff should be highly educated, qualified, and we should not be associated with unfair means, and patient should be given respect, dignity in all respect, in the wards, in the admission, in the OPD, even in operation theatres, even in the post-op, even in the follow-up. So all the human dignity should be maintained in all scenarios, and our staff, and we should not be anywhere demeaning to them. So in this way we will be respecting ourselves also, because someday we will be patient and we will feel the same, and so if they we should respect the patient also. And in this overall we are just giving respect and receiving respect, and but as a doctor we have to give respect and give respect to the person dignity, and that can, in that dignity, his culture, his orientation, and his thought, and his ideology, and even his practices, social and religious practices, that all are accounted, and we should be respecting everything, because if somebody is having belief that he cannot take the blood, but it is the need of the hour that the patient should be given the blood. But if patient is not is again the patient's religious belief or some belief that he will not be receiving any of the blood, then we should not infuse the blood because the person doesn't want. In that, if the state laws are different, then we should inform the authorities. Authorities will analyze that situation, and authorities will direct us whether we have what to do or not to do. But we should not take the whole thing in our hand and act like God that we are the savers of the life and we can save it. Though we have various different provisions in case of emergency or doing things in good faith, but there are different scenarios that we will be discussing in the coming slides, that we are having various scenarios and various conditions in which we have to act in emergency and in good faith of the patient. So that two are being protected by the law. We will be coming to that. Concept of informed consent. World Medical Association in Declaration of Helsinki emphasized upon importance of informed consent for medical research by adequately informing the subject of aims of the treatment, methods of the treatment, anticipated benefit of the treatment, potential drawbacks or we can say that the morbidities, discomfort which which the study may entail, means any of the discomfort. So we should take consideration of all this so that we can make a rational person can make a rational decision on that and give a consent to that. Most of the time, sometimes people think that willing of a patient to go under treatment and the informed consent are the same things. But we will be telling in this lecture that both are the different things. Informed consent and the willing of the person to go under the treatment are the things that are different, and we will be seeing in the coming lecture, coming slides, that how the things are different. Personal integrity and informed consent respects and protect the personal integrity of the person by affirming that what is to be done on her, that I have already discussed, that we have to maintain the personal integrity of the person and respect that, affirming then what is to be done on the person's body. Personal integrity includes health issues like physical, mental, emotional and spiritual aspect. So we have to respect every aspect of the person. The well-being of a person is not only a clinical matter, it is that is to be addressed, but also endorses the self-esteem. In any way, we should not demean the person. Self-esteem of the person should be respected and kept in the spirit. Integrity of the person means none of the things should be divulged, or even the integrity of the person should be maintained. The wholeness of the person means it doesn't mean that we are dealing with one part and we don't take person as a whole. Now that it is happening, we become so specialized that we only look at the finger, we can look at the foot, we doesn't take the person and hold, we doesn't endorse the person's mind and person's state of mind and all that. These things are happening because of the super specialization. But we should be very much be looking into persons along with physical, mental, emotional or spiritual issues. As a super specialist, as some specialized subject, we generally deal with one aspect of the disease or one aspect and leave the patient. But in fact, though we are dealing in one aspect of the person, we should keep in mind that he or she is the person, and his physical, mental, emotional and spiritual issues also we address in the same thing. and while doing that small procedure or a small specialized procedure, it means we should not disrespect the person. So the being so specialized sometimes get us deprived from these aspects also. So we have to keep in mind that we should respect patient in all the aspect. Justice Cardozo was one of the pioneer in doing this, who gave the judgment, and in 1914 that every adult human being of sound mind has the right to determine as what shall be done to his body. Means he was the pioneer in 1914 that who he gave the judgment that if somebody is to be operated or somebody is to be going through any medical procedure or any of the medical things, then if he is a sound mind, then he should be the decider, but not the doctor or the medical staff or his family and all that, that he should be the decider what should be done on his body or not. If the surgeon performs an operation without the patient consent, it is considered to have committed an assault for which he is liable to pay the damages. We have already, I have said that we should not act like elderly brother, or we should not act like as the father figure, or we should not act like the God to the patient. We should just act like the service provider, and we should always take the consent to go forward. And National Medical Council laid down the rules according to which surgical treatment without consent is considered a misconduct and is punishable. So our councils are also against the procedure which are forced, not being consent has not been taken properly. So we should be aware that consent and the person are the supermost part of the treatment. Consent, Indian Contract Act gives the basic foundation for the consent, defines that though it was not initially made for the initially understood for the medical procedure, now it is being clearly understood that consent is basically a type of contract, defines when two or more persons agree upon the same thing at the same time and in the same sense, provided the consent has been taken prior to coercion, not under the influence of fraud or misinterpretation and mistake. We should consider that these should not be under influence, fraud, misinterpretation or mistake. So we should be aware that it is a contract and it should be taken properly. Valid consent needs various points to be emphasized. Valid consent is one that is given voluntarily without any element of duress and is to be given by an individual who has duress means any stress or any pressure. An individual who has legal capacity. Legal capacity has various things to do, which we will be telling in the future. In the coming slides, in the terms of age and mental competence. Person should be of 18 years of age and mentally sound. This legal capacity is legal age and mental capacity. Given with the requisite information of the risk, we should be providing all the information of the procedure, side effect and the alternatives, and the patient is able to make an informed decision. After knowing all this, patient should be able to take the decision whether or not proceed with the treatment. So, these are the three components: legal capacity, requisite for informed risk, and the informed decision. We should be focusing on the three components of the informed consent. Continuous process. Once this is one of the some of the misunderstood things that consent is once taken, it is considered absolute consent and it cannot be reverted and all that, or we should go for the procedure for definitely without any roadblocks, but the roadblock is always there. The patient himself or herself can stop you at any time. He has or she has right to stop the procedure at any time. So consent is a continuous process, and after due information the patient gives contradictory or doubtful signals in a particular procedure. If a person is going under local anesthesia and going under the procedure, he sees more blood flowing or bleeding is there, he can stop you, make you stop, whether that may be against the patient, but we have to stop it because the person has said that he needs to stop the procedure because he don't want to proceed further. So we have to stop it and we have to look into it that we have documented that the patient has stopped us, and even though we have explained the procedure that if the procedure is being not carried out, person may die, but we have to stop that because it is the autonomy of the person that he has right what should be done in the body or not. If anything very grave is there, person has become unconscious, then somebody comes to in his place and take the charge of the body and he will give the consent depending upon the local authorities. But we as a person, we as a doctor, we should stop when the patient said stop. He also has right to withhold consent at any point of time of going procedure. He can withhold the consent. So continuous is the correct term, means nothing, one consent should not be considered to be absolute because consent can be withdrawn at any time. Misadventures sometimes happen. In Indian Penal Code provides protection to the doctors against legal actions in any misadventures that has happened during the procedure. Misadventures means intention was not there, but something has happened which was not usually expected. So all the procedures have some great risk. Even medicines have risks or sometimes very abruptly behave in the body. So for that the doctors may not be held responsible. It should be done in good faith, taken well informed consent, patient and the relative or legal guardian in case of minor, and we are protected in the IPC 87, 88, 89. We are protected into that. We should be, but we should be doing in good faith of the patient. And we have informed already about the patient. Sometimes an anaphylaxis happens with the penicillin or moxicillin. So that is a mid-adventure because it is a high one of the complex reaction or adverse reactions, but it is not a regular. So it can happen to anybody and at any time. So that happens and we should inform the patient. Now we are coming to the actual classification of the consent, one of which is implied consent, means understood. Implied is sometimes we go for understood, but it has limitations. Sometimes we cross the limitations and we land up in trouble. Implied consent is the trust and empathy which a patient develops with his physician when he or she comes in contact, and due to this empathy he allows history and examination of himself. He or she allows history and examination of himself. So during the initial, when the patient comes to our OPD or our consultation chamber, we just by eye contact and by just thing, we developed a trust into that, and we can take the history and the examination, some part of the examination also, and the patient allows easily in that. But we should be guarded with ourselves. This empathy and trust form the basis of implied consent, and is the most commonly implied type of consent in general and medical practice, because we generally go for OPD consultation, outdoor patient consultation. So generally most of the time the flow is about, nowadays we are having 4 to 5,000 patients in daily. So we don't have time for that to take all the consent on the written form and all that. So it is the most commonly employed in all over the India, that it is commonly employed, commonly used consent up to the some part of the examination. Implied consent is limited to examination up to inspection of the body or the part, palpation or auscultation of the chest, excluding the examination of intimate parts. This definition of intimate parts is not quite clear in India, because in intimate parts we are having, in India we having the breast of the female and the genitals of male and females. But in other countries in like UK and in Europe, they considered all the orifices, including eye, nose, ears, mouth, anal region, even the urethra. They all considered uh, intimate part. So we should be also be exercising the same thing, but in some countries like where the DNA is sometimes very routine process, so the examination of the oral cavity of taking the swab from the DNA has been excluded. But in India we have no proper guideline for that. So as I am emphasizing on it since last 10 to 20 years, that there should be a proper guideline to this, but we should abstain from the examination of the genitalia and the breast, and then also abstain from the cavities or the openings of the orifices of the body, and we should take a verbal consent on that. We are in the presence of disinterested party, that is, this is interested party is most of the time is our attendant, and maybe the attendant of the patient also, but depending upon the scenario. The definition of intimate part is not very clear in India, but generally the private parts are considered intimate part. So we should be very much vigilant on this.